Okay. So it's 11 a.m. So thank you so much for the participants who joined on time. I hope I'm audible.
Yes, I can hear you.
Yeah. Okay, great. So yeah, good morning, everyone. A very warm welcome to the Health Pep Talk. This is a makkalnalan initiative jointly organized by Kids and Teens Dental Clinic, Rain Dental Care, IntelliWealth Advisors, and SS Aqua Technologies. Today's topic is an extremely critical component for a healthy society, and that is women's health and well-being. We have today's panel, we have three eminent doctors. Dr. Madhupriya, she's a senior consultant gynecologist. She's going to be talking about fertility. We have Dr. Arockia Virginia Fernando. She is a fertility and IVF consultant at Cloud9 Fertility Hospitals, Bangalore. She's going to be sharing with us post-pregnancy wellness for women. And we have Dr. Vijayashree Saravanan. She's a consultant urogynaecologist. She's going to be discussing about post-menopause women, health tips. And hi, I'm Nithya. I'm an image consultant and founder of Habbada Fashions, and I'm going to be your moderator for today. So before we jump into the topic, I'll quickly brief you on the format for the day. Right? So we'll have each panelist talk about their topic for 10 minutes. So once all the three panelists finish their talk, we would open the floor for questions. You can post your questions on the chat box, if possible, along with the doctor whom you think can answer the question best. Then we would take this question to the prospective doctor and have them answer it. We will try and to take as many questions as possible. So today our first panelist is going to be Dr. Madhupriya. Dr. Madhupriya is a fertility physician at Nova IVF Fertility Hospital. Having an experience of more than a decade, she's a gold medalist in her graduation. She's also a recipient of Jagdishwari Mishra Award. She's had many best scientific papers and e-poster awards like OGSSI 2007, RCOG 2014, AICOG 2015, Get Endo 2018, and Yuva ISAR 2018, to name a few, and had many scientific publications. She's also a co-author of a book on IUI. She's an acknowledged speaker at several state and national level conferences. Her special interests are in biological hair for poor ovarian reserve patients, fertility in cancer patients, and androfertility. Thank you so much, Doctor, for joining with us today. Over to you.
Thank you for that nice introduction, Ms. Nithya. And good morning, everybody. I'm Dr. Madhupriya. And at the outset, I would like to welcome you all for this public webinar. And my topic for today is on fertility facts. Can we go ahead with the slides, please? So let's first get to know, what do we mean by infertility? A couple is called an infertile couple only after they have tried to conceive for about 12 months with appropriate regular sexual activity with no protection, that is, no contraception like condoms or use of any contraceptive pills. So when they have no problem in the sexual intercourse, no problems in the lady with the sexual activity, no pain in her, no problems like erection and ejaculation in the male partner, and they do not have any major medical or surgical issues of the past or present, then after 12 months of trying for a conception, we consider them to be infertile couple. Next slide, please. Let us know how big is the problem worldwide or in the Indian scenario. Can we have the next slide, please? So the graph in this picture will show you that worldwide statistics shows a decrease in the fertility rate and an increase consistently of the infertility population. As far as the Indian statistics is concerned, the total fertility rate have dropped a lot. As you can see in the graph, from 5 children per Indian woman on an average in the 1970s to about 2.2 in the 2010 decade, and now approaching 2025, it's estimated to be less than 2, that is 1.2, and by 2050 it is less than 1, which means that by 2050 there would be a lot of infertile couple having no children. Next slide, please. So let us analyze what are the reasons of infertility rise in our country. A few are worth noticing, like increasing age of the partners at the time of marriage, or even after marriage, the time that they actually try for the fertility. Because of them being really stressed, or because of them gaining weight, or due to alcohol consumption, smoking in both the partners, there is an unhealthy lifestyle which also had been increasing in the recent decades. Presence of sexual dysfunction in one or both the partners, presence of underlying medical issues like diabetes, hypertension, asthma, thyroid, tuberculosis, presence of fits, or any surgeries in the past of any of the partners can also lead to infertility. Mainly decrease in the quantity as well as the quality of the eggs in the female partner and the sperms in the male partner could be an important reason. Socially, there could be unawareness or absence of guidance among public on when to approach the fertility physicians, what to expect from them, and how to assess the fertility treatment. And there could still be indecisiveness in treatment initiation even after meeting the fertility physician or the gynecologist. The treatment initiation is subjective to socio-economical factors, to the marital issues that they had been going on with. So there are many factors around which leads to indecisiveness in starting their treatment even after knowing what their problem is. Next slide, please. Before we go into pondering the causes of infertility, let me put across with most authenticity that the cause of infertility in female is equal to the cause of infertility due to male factors. So there is no blame game. There is no particular person to be pinpointed for the infertility. The couple on the whole are assessed as well as treated as a wholesome. Next slide, please. Now coming to the male factor, as is shown in the picture, the centralmost organ, the uterus, where the embryo becomes a fetus and pregnancy happens. And on both sides, you have the tubes, which are called the fallopian tubes, where the egg, which is released during the ovulation in a female in the mid-cycle, comes in contact with the sperms, which are deposited in the vagina of the lady and forms an embryo. And this embryo travels through the other half of the tube to reach the uterus, where it gets implanted or it gets attached to the uterus lining, and this results in pregnancy. So presence of any problems in the ovary or its function, presence of any block in the tube, or presence of abnormality in the uterus or its lining, which is called endometrium, can result in infertility. Next slide, please. Coming to the male factor, the semen analysis is the foremost initial basic step to be taken in assessment of male or for assessment of infertility in the couple altogether, because this is a simple test and this clears that the male side is okay to go ahead with the natural cycle, or there is some treatment that is necessary in the woman depending on the male factor. As much as the male factor is normal, the lady needs minimal treatment if all her female factors are fine. As the count of the male sperms goes down or the quality goes down, there is an increasing amount of treatment that the lady needs proportionately. So it is important to make sure that the count, the concentration, the movement of the sperms, which is called motile sperms, and the morphology, which indirectly tells us about the quality of the sperms. These have to be determined and seen whether they are within the WHO's proper normal morphological criteria. Next slide, please. Coming to the ovulation factor. Ovulation is otherwise release of the egg in a female in every menstrual cycle, and this is mostly an egg-related issue. As you can see in the center of the picture, the normal ovary has about 5 to 10 good antral follicles, which is the house where the eggs get formed. As you can see in the upper slide, where a picture shows polycystic ovaries. This probably many of you would have heard. Polycystic ovary is a hormonal imbalance with too many follicles that not even a single becomes dominant to release egg. So that has to be corrected to make them pregnant. There could be ovulatory dysfunction because of very low number of follicles as seen in the lower picture, which shows 1 or 2 antral follicles only that might or might not result in production of egg. So this shows that the ovary is small and the number of follicles that she has is too low. Maybe she is going in for premature ovarian failure or her egg reserve is poor. Next slide, please. Coming to the tubal factor. As I told you, the tube is the place where the egg and sperm meet, and the presence of any block in the passage of any one or both the tubes can lead to increase in the infertility. And presence of abnormal tubes such as hydrosalpinx or some inflamed tube can result in even a life-threatening ectopic pregnancy or a tubal pregnancy. Hence, this needs to be assessed, and if there is any problem, that has to be corrected as far as the tubal factor is concerned before we proceed with the fertility treatment of the female. Next slide, please. The important factor, just like a soil is important for the growth of a plant, for the growth of an embryo, it is very, very important that the uterus is good, the blood supply to the uterine lining called the endometrium is good, and the uterus does not have any abnormalities. As you see in the picture, the first picture shows the ultrasound of a properly thickened and proper pattern of an endometrium or the uterus lining. And the last picture shows vascularity, that is good blood supply is there in the uterus lining. And the central picture showing the inside of the uterus on a hysteroscopy, which is quite normal. So presence of all these factors tells us that there is a high chance that fertility is achieved, and there should be not much of a problem in the implantation if a good embryo is formed. Next slide, please. Coming to some of the abnormalities, what are the normal abnormalities that we see when we basically assess the uterus, tubes or ovaries? Or as we saw, either a decrease in the antral follicle or polycystic ovaries. Apart from that, let us go in row. The first picture showing a bulky uterus, which is also called adenomyosis, which results in decrease in the attachment of the good embryo to the uterus lining. And the second one shows abnormality in the uterus. This is otherwise called a septate or a bicarbonate uterus. அதாவது பிளவுபட்ட கர்ப்பப்பை. The uterus is not normal. It has an abnormal anatomy. The third one, which shows an extra growth of the tissue within the uterus lining, which is called an endometrial polyp. Coming to the second row, the first one, we see a big inflamed tube, which is an unhealthy tube, and this needs to be taken care before she undergoes any fertility treatment. Coming to the second row, the second slide, where a red star is seen, on a tubal testing on a HSG, we find that the tubes are not visible. The tubes are blocked. The presence of blocked tubes usually can be an important factor of infertility in about 20% of women. Coming to the last row, we see an ovary which is inflamed because of a cyst with papillary excrescences and increased blood supply, which means that this cyst is pathological and this needs to be treated. And the last one, a bluish tint showing an inflamed tube again on a HSG, which shows that the tube is very unhealthy, which needs to be tackled before going ahead with the fertility treatment. Next slide, please. So, for a normal pregnancy to happen, a normal endometrium or a uterus, just like a good fertile soil, is necessary to receive the embryos, and good seeds in the form of gametes, sperms in the man and the eggs in the female, is necessary to give rise to an embryo. So let us know how to approach infertility and when actually to approach a fertility physician for the treatment per se. These are some of the reasons why we would expect the couple to meet a doctor. Couple who have had sex without any birth control, but they have been trying for more than 12 months, as we saw earlier. An age of the female partner being more than 35, an age of the female partner more than 35 with a male partner more than 40 years of age, irrespective of the number of years that they have been married or they've been trying for pregnancy, needs to have a checkup. Couple who have had multiple miscarriages, 2 or more, then they will have to meet a fertility specialist. Male partner who has trouble in sexual activity in the form of erection or ejaculation, or the female partner has difficulty in the penetrative sex like vaginismus, or has problems in the menstrual cycle in the form of no periods or irregular periods, or they have pain during periods, or they have excessive flow during the periods, then they need to meet a gynecologist or a fertility specialist. Couple who also have controlled or uncontrolled medical issues, who have had previous surgery where the gonad or the egg or sperm producing organ has been removed during childhood, or those couple who have all basic tests like a semen analysis in the male and the scan as well as the HSG or tube test in the female to be normal, and they've been trying for more than 2 years but not yet conceived, then they are at high risk of having unexplained infertility, who need to meet the fertility specialist as early as possible. And couple who are referred by eminent gynecologists after the basic fertility treatment have failed are also at high risk of developing advanced infertility problems, which needs to be assessed by the fertility specialist. So I think just that gives you a glimpse of what an infertility and how prevalent it is and how to tackle it per se. I'm open to questions at the end of the webinar. Thank you all.
Thank you so much, Dr. Madhu. So I'm sure there are going to be questions that we will take towards the end of the session. So thank you so much for that. I'll just quickly stop sharing the screen. Okay. So now I'd like to invite our second panelist, Dr. Virginia Fernando. She is a fertility and an IVF consultant, obstetrician and gynecologist at Cloud9 Fertility Hospitals, Bangalore. She has 15 years of experience in the field of medicine, of which 10 years were in gynecology and 5 years in the field of infertility and assisted reproductive technology. She's done her MBBS from Stanley Medical College, Chennai, diploma in obstetrics and gynecology in Bangalore Medical College, and fellowship in reproductive or fertility medicine from IVI, Spain. She practices gynecology as well as advanced assisted reproductive techniques and has a special interest in writing blogs, creating public awareness videos, and giving health talks. So thank you so much for joining us today, and over to you, Doctor.
Thank you, Nithya, for the introduction. Good morning, viewers. My topic for today is post-pregnancy wellness. Let me take you through the topic. The agenda is I'll be introducing you to what is post-pregnancy, the phases of post-pregnancy period, post-pregnancy care, what are the common problems, and the solutions to those problems. So what is post-pregnancy period? It is also called postpartum period. That is the first 6 weeks following childbirth. That is the first 40 days. That time, there is a lot of physical and emotional changes which the woman has to undergo. The hormones and the uterus returns to the non-pregnant status. Adapting to the newborn's needs and to the changed environment is a very important thing around that time. It is a period of healing. It is a period of rebuilding strength. Regaining the pre-pregnancy shape is vital. And so, support and reassurance is very, very important at this stage. This is one of the most neglected phase of a woman's life, and if it is not taken care, it leads to many problems later. So after childbirth, the discharge from the hospital. If it is a vaginal delivery, it is after 1 or 2 days. If it is a cesarean section, the postnatal stay is for 3 to 4 days. During that time, the mother is monitored for bleeding, the bowel and bladder functions, and the baby care is taken care of. There are 3 phases of this postpartum or the post-pregnancy period. The first phase is acute phase, that is the first 12 hours after childbirth, which is very crucial. Then the subacute phase between 12 hours to 2 weeks, and the late phase up to 6 weeks. During the acute phase, that is the initial 6 to 12 hours after birth, is very, very crucial because many complications happen during that time. It can be bleeding, it can be pain in the episiotomy stitch area. If it is a vaginal delivery, there might be a vaginal cut. There might be swelling in that area because of internal bleeding. There might be pain in the cesarean wound. And another common problem is flat nipples. Many ladies face this problem of flat nipples, and there is difficulty in feeding the baby. And we have to pull out the nipple, so it creates some problem in the initial phases. So there is a lot of anxiety. Whenever the baby cries, the woman is anxious. So around that time, what is the care given at hospital? Of course, they take care of the woman, but for your general knowledge, I'm elaborating this. If it is a vaginal delivery, after the delivery, immediately fluids and the diet can be started. Of course, have a watch on the bleeding. Immediate breastfeeding is to be started, and encourage the woman to pass urine by 6 to 8 hours. And if there is pain in the wound, the vaginal wound, ice pack is kept. After cesarean section, the same, watch for bleeding, immediate breastfeeding. Even in the lying down position, the breastfeeding has to be initiated, even if it is a cesarean section. And movements of the hands and the legs can be started after 6 hours. It doesn't mean the woman has to lie down like that on the bed. And there is a urine catheter put for 24 hours. It can be removed before that also. It depends on the recovery of the woman. So generally painkillers, antibiotics, and IV fluids for hydration is given. But orally, like fluids can be started, water and other fluids can be started after 6 hours, and diet can be started by 12 hours maximum. The next is the subacute phase. That is, the woman has crossed 12 hours and is up to 2 weeks. That is after the discharge of the hospital, from the hospital also. The most common problems around that time is sore or cracked nipples because of dryness in the breast and the nipples, breast pain because of engorgement, too much of milk, and next is piles, because of piles or because of constipation. And incontinence is a very common problem of a vaginal delivery, or if it is an instrumental delivery like a forceps, they cannot hold urine while sneezing or coughing. This happens for the first 2 weeks. There can be shortness of breath if there was excessive of bleeding and because of fatigue. The legs can be swollen 2 to 3 days after delivery. And this is very common because of water retention in the body, fever, sleep deprivation. It's very, very common because the baby gets up every 1.5 to 2 hours, and there can be loss of blood. So the hemoglobin can drop down, and there can be very less milk production for few women, and there can be fatigue also. What is the essential care, daily care to be given for this women around this time? First of all, there should be emotional well-being. She needs a lot of support from the partner, from the extended family. Infant care is very important for the feeding, to help her in the feeding, the sitting posture, to help her in the feeding, for burping of the child, as well as to change the diapers, for the immunization, etc. Moisturize the breast and the nipple area well. Coconut oil can be used, or any other moisturizers can be used. Creams can be prescribed by the doctor for cracked nipples. Walking should be started. The woman should start becoming mobile as early as possible. If it is a vaginal delivery, the same day, and if it's cesarean, the next day, the woman should be walking around, at least outside the room. Nutrition should be a normal, balanced diet. And about the diet for breastfeeding, I will elaborate later. About the vaginal wound care around that time, like after discharge, when you go to home, sitz bath is advised. It's a warm water kept in a tub, and the woman is made to sit on it with the antiseptic lotion put in it. And this helps in the reducing the swelling in that area where the stitch is put, as well as to relieve the pain. Antibiotics are continued, or painkillers are continued for 5 days. Avoid sitting cross legs, and antibiotic ointment is prescribed, and a daily shower is very important. It is important to keep that area dry and clean. Yes, there will be bleeding post-delivery, but make sure that the area is kept clean. For the cesarean wound care, also same thing. There is a lot of taboo that daily bath shouldn't be advised. Even with the plastic dressing, daily bath is advised. Keep the area dry after bath. Suture removal is usually done after 7 to 8 days. Sometimes the suture is put under the skin, so sometimes it is not necessary, but a visit to the doctor is very necessary after 7 to 8 days. Clean the wound and keep it dry. Abdominal belt is advised. That is, many women ask whether this belt is useful for putting my tummy inside. No, it is for back support as well as to hold the abdomen tight, because the muscles, the rectus muscle is overstretched because of the pregnancy, and it has lost its tone. So it hangs loose, even the skin hangs loose. So because of that, when the woman moves around, there's a lot of pain. So to give a support to the abdomen, this abdominal belt helps. So high-waisted underwears are available nowadays, which also serves the same purpose. Okay, important is a post-delivery doctor visit. This is very, very important because it is 1 week after delivery for the suture removal or for the inspection of the vaginal wound if it is a normal delivery. 6 weeks after delivery to assess if the uterus has gone back to its normal shape, if there is any other infections, and important is contraception advice. Yeah, repeat blood tests are done around that time if the woman had some thyroid problem or diabetes. The tests are done, and the dose alteration is done for thyroid medicine, because many women face hypothyroidism after delivery and it becomes very severe, and they have a lot of depression because of that. Late phase is between 2 to 6 weeks. Around that time, usually the woman is settled, the newborn is settled, the feeding pattern is all set right, and then woman knows how to feed and how to take care of other things. So now what are the problems faced around this time? There's a lot of hair loss. 3 months later, it's called postpartum alopecia. Many women lose their hair around their temple regions. It's because of the hormonal effect. The hormone levels are very less because of breastfeeding. And so that's why the hair fall happens. But this is not to be worried. The hair grows back normally. The treatment is not indicated. Just good care for the hair is enough. Next is postpartum thyroiditis. That's what I had mentioned already. First, the hormone levels goes up. The heartbeat goes up for immediately after delivery for many women. And after that, it comes to a hypothyroid state. In that state, the TSH levels is very high. And many women faces this problems of constipation, fatigue, leg swelling, and they are very sad always. They'll appear swollen. So that needs to be addressed. And breast abscess is very, very important. If after breastfeeding the baby, the breasts are not completely emptied, and if there is redness, and if there is warmth, it has to be identified early. Otherwise, the collection of milk in the breast gets infected and becomes a collection of pus, that is the breast abscess, which has to be drained and removed, and that is not a very pleasant experience for the woman. The next is postpartum blues. That is being sad and being irritable, and I'll deal with it later. So this happens around this time. But after 2 weeks, usually the infant sleep happens, gradually increases, and the mother's sleep also improves. That's a good thing after 2 weeks. The care in the late phase, that is after 2 weeks. Exercise is very, very important. Brisk walking can be started even after 2 weeks of delivery. Toning exercises, abdominal exercises can start after 1 month. Restorative yoga, the normal yoga asanas, And back support is very, very important at this stage. Back pain comes because of prolonged feeding. So proper chair with back support is very important during feeding time. And exposure to sunlight is very important for the newborn as well as to the mother, not only for the vitamin D, for the general well-being also. Definitely rest and rejuvenate. See, sleep when the baby sleeps. You cannot take care of everything at home. So we need help, but take enough rest and hire help for other activities too. So be open about your feelings. Some women have a lot of anxiety. They are very sad and worried about so many things in life. So please be open about that. And if somebody has a depression kind of a feeling, we need to be alert. And warm packs for the breast to prevent breast abscess. It needs to be emptied completely after each feed. What are the medicines given after discharge from the hospital? Usually antibiotics are prescribed, be it normal delivery or cesarean, painkillers, iron tablets, and calcium tablets. Usually we prescribe for 6 months, and vitamin D is also very, very essential. For the recovery of the wound, if a high protein diet is necessary, we prescribe protein drinks, protein powder to be mixed in milk. So the ointment for the maybe for the vaginal wound as well as for the cesarean wound. When does the period start after delivery? This is a very common question from women. So many after delivery, there is bleeding for up to 2 weeks. Sometimes on and off spotting and bleeding can happen after up to 6 weeks. That is during the post-pregnancy phase. So non-lactating women, that is women who are not feeding the baby, they begin their menstruation normal cycles by 6 to 8 weeks even after delivery. But those who are doing an exclusive breastfeeding, that is they're feeding only the breast milk and nothing else, no other top-up milk, they can have their periods after 6 months. It can go up to 2 years. That's nothing abnormal in that. The first period is prolonged and profuse. It usually happens. The ovulation can also resume anytime. Even if the period has not come, the ovulation can resume. So anytime pregnancy is possible. So contraception is very, very essential after 6 weeks. So I'll talk about the postpartum blues. So 50% of the women experience this feeling of sadness, an unexplained sadness. They cannot account why they are sad. But that is because of the hormone levels, sudden decrease in the progesterone and estrogen hormone levels after delivery. There is a low self-esteem, the feeling of dependence on others, physical discomfort, pain, the tension, let down feelings, irritability, and there's a lot of crying episodes, seeing the baby crying, not able to handle the baby or not able to feed the baby properly. There's a lot of gap between the ideal and the reality. So who are the women prone for this anxiety? Who had the first delivery, who had long and prolonged labor, who have financial anxiety, the social isolation, there is a marital disharmony or crisis in the extended family, and single moms. These women are at high risk for having this postpartum blues, which can progress into depression. So they need help. So postpartum depressions is all after 2 weeks. So if a proper attention and support and the necessary counseling has not been given at that point of time, it can progress to a depression, which can extend even up to 6 months. So the drop in the thyroid hormones also plays a very, very important part along with the estrogen and progesterone hormones. The woman feels very depressed and exhausted. But that is why the thyroid hormone levels has to be repeated postpartum and accordingly to be treated. Sleep deprivation is the most important aggravating factor. If there is a previous history of family history or a previous history of depression, we have to be on the alert. How to tackle this postpartum blues. First of all, identify the problem. Identify the women who are at risk. Emotional support is the first and foremost thing. Physical support and the baby care is necessary from the partner as well as from the extended family. Ask for help. The woman has to ask for help and be open about what she feels, or if she is dreading something or fearing something, she has to be open about that. And there is a need to relieve the pain. The pain after cesarean can last for some women even up to 2 weeks. So there is a need to relieve the pain, adequate help to take care for the household needs, support for babysitting. It's very essential to talk to friends and well-wishers to express our concern, to take their inputs and their help. But it's also necessary to limit a lot of visitors because that also puts a lot of stress on the woman. about the diet post-pregnancy. This is a very discussed topic, and many have a lot of taboos about that, a lot of doubts about that, what to avoid, what to take, what not to take. A good balanced diet is advised, a normal diet is advised. Let it be a high protein one. Additional snack, fruits and yogurts are advised. Extra at least 300 calories is advised. And diet should be rich in iron content like dates, almonds, spinach, dark leafy vegetables, meat, eggs and fish are high in proteins. Fruits which are high in vitamin C like citrus fruits. For vitamin A, for the healing, papaya is necessary. Vitamin C also helps in the healing of the wound and for the recovery. Plenty of fluids is necessary. Please don't restrict the fluid in the diet. You need lots of water, lots of fluids, be it milk or juices or soups. It's very, very essential. More than 2 liters is essential for a woman around the feeding period. Sweet potatoes and whole grains rich in fiber to avoid constipation so that you don't have a problem in that vaginal wound area. And fruits and fiber-rich food is very, very essential. About breastfeeding. So breastfeeding has to be started as early as possible, as soon as the birth of the child. And the first 3 days, there's a watery colostrum. Please don't ignore that it is not milk. It is a watery, the colostrum is milk only. There is a lot of nutrition in that. And after 3 days, it becomes thicker. Even if there is 5 ml also, it's enough for the baby. So regular feeding is very, very essential. And people think it is not necessary. Only if the baby cries excessively, the baby has to be given enough warmth, and if still the baby cries and there is no passage of urine, yeah, extra top up feeds can be given. So frequent regular breastfeeding is very, very important, every 2 hours, and there should be a confidence in the woman. So first of all, you should need to be confident that I can feed my baby. Adequate back support, proper seating arrangements, seated chair and hand support is necessary for breastfeeding. And daily showers necessary, keep the breast dry and clean. And breastfeeding has a lot of benefits for the woman. It helps to lose weight and helps to go back to your pre-pregnancy weight faster and reduces the risk of breast and ovarian cancer later on in life. So this is also a very common question: how to increase my breast milk? What do I eat? So oatmeal is very important. It increases the breast milk. Chickpeas, these are called galactagogues, which is known to increase the breast milk. Garlic, fennel, drumstick leaves, adequate fluids, hydrate, and have healthy snacks and soups and juices before each feed. And your doctor also can prescribe some tablets which can improve the milk output. But the most important thing is adequate suckling. If the baby suckles, the more the baby suckles, there is a stimulus to the brain which can cause more milk production. So if the baby doesn't suckle often, the milk production doesn't increase, whatever food you eat and whatever tablets you take. Sexual dysfunction is a very, very common problem after 1 month or 2 months. When they want to resume their sexual activity after 6 weeks, many of them are not interested. That is mainly because of the fatigue and the fear of pain in that area. And pain during intercourse can usually occur for many women after 2 months due to dryness of the vagina. That is the same problem. That is, the hormone levels are down because of breastfeeding, and so this problem can occur because of dryness. How to tackle this is only the partner's understanding. Reassurance is very, very important. This problem settles on its own. Lubricating gels can be used, but usually it subsides on its own. Exercise, very, very important to tackle all the problems which I have elaborated. So core strengthening exercises, that is the abdominal exercises to build up the muscles of the torso, and Kegels exercises is very important after vaginal delivery, which helps to regain the bladder control. That is,
Doctor, sorry, if we could just, so that we'll have more time for questions. So
yeah, I'll finish it.
Yeah, thank you.
So brisk walking after 2 weeks, and this gives a sense of well-being. So go slow, but do exercise. Restorative yoga can be used, that is, can be very useful, like stretches to beat the postpartum depression. So you can start after 2 weeks after following the normal delivery and 1 week after C-section. Contraception. So after 6 weeks, when one resumes sexual activity, as I already elaborated, ovulation can start anytime. Contraception is very, very important around this time to prevent unwanted pregnancy. The effect on the future fertility. If proper care is not taken, whatever I've explained, and good nutrition not provided, the above factors can reduce the possibility of secondary infertility. Because of infections, many women have difficulty in conceiving the next time. For the stretch marks, it's a very common problem. Coconut oil and oils and massages to moisturize and prevent dryness. So the take-home message is this period is amazing. To make it memorable, the first and foremost thing is emotional well-being, family support, early starting of breastfeeding, good nutrition. Please leave the taboos, early exercise, wound care, iron, calcium, vitamin tablets, and sunlight is very, very essential. Thank you for your patient listening.
Thank you so much, Doctor. So we'd quickly move on to our next panelist, Dr. Vijayashree Saravanan. She is a consultant urogynecologist at Cure Healthcare, visiting consultant at St. Isabel Hospital. She graduated from the Manipal University and completed DGO at Keelpok Medical College, completed advanced training in urogynecology and vaginal surgery, affiliated to the Royal College of Obstetricians and Gynecologists, London, presented at several national and international conferences, worked in different hospitals across Northwest England over 12 years, like St. Mary's, Central Manchester, Royal Blackburn Hospital, and Salford Royal Hospital. She's a member of the International Urogynecologist Association. She relocated to Chennai in 2014 and founded Cure Healthcare to provide quality healthcare to women. She's passionate about improving health awareness in women and adolescent girls. So thank you so much for joining us today, Doctor, and over to you. And if we could keep our talk to about 10 minutes, then we could have a lot of time for the questions.
I'll try my best to be very crisp. Thank you, Nithya, for the introduction. Good morning, viewers. I'm Dr. Vijayashree, and I specialize in urogynecology. So I'm going to be talking to you about issues, women's health issues after the age of 40. So what are the common general issues that women face after the age of 40? So obviously nowadays with all the medicines and the medical management and treatment that's available, the life expectancy of women has increased, and so we do spend almost 1/3 of our lifetime after menopause. So it's very important to keep this time of our life healthy and active so that we enjoy a good quality of life. So the general health concerns like diabetes, blood pressure problem, thyroid problems, heart disease, these are actually quite similar to what men have as well. So these are going to be there after the age of 40, which obviously are the same as for men. Thyroid issues are a bit more commoner in women. So please do make sure that you do get regular thyroid tests done after the age of 40, at least once in a year, just to check that there is no issue with your thyroids. So menopause related problems, which I'm going to discuss, pelvic floor related problems, which is more related to bladder and bowel control. So these are some things that women are going to be facing after the age of 40. And cancer, with increasing age, one of the issues that's recently become reasonably common is cancer. So the best thing for cancer is to detect them in the early stages so that they are treatable. So when cancer is detected in early stages, they are completely treatable. So that's extremely important to be looking out for cancer in the early stages. So what exactly is menopause? So menopause is when you have no periods for 12 months. So it doesn't happen suddenly in all women. In some women, it happens slowly in phases. Like the periods tend to start spreading out, once every 2 or 3 months, once in 6 months, and then there will be no periods. But once you have no periods for 12 months, if you do see any bleeding after that, that needs to be checked. You need to see a gynecologist, and that needs to be checked, because bleeding after no periods for 12 months is actually called postmenopausal bleeding, and we need to make sure that there is no other sinister causes for that. So menopause actually is a normal part of aging. That's when it happens after the age of 40. Yeah. Rarely some women do undergo menopause before 40, which is called premature menopause. There are certain causes to it, certain hormonal conditions or certain genetic conditions, but usually after the age of 40 is when menopause happens. In Indian women, the normal age nowadays seems to be between 45 to 50, common age of menopause. So it is a gradual change. Like I said, periods become a little bit irregular. You might start feeling certain hormonal symptoms, and then you slowly go into menopause. So it can last, that change can actually last from 2 to 5 years. In some women, it lasts for around 5 years as well. Most women are actually unaware of the impact of menopause on their health. Menopause is not anything abnormal. It's not a disease. It's a normal change. So it's very important to know about the effects of menopause and how to handle it. So if we do look after ourselves well during menopause, you can lead an equally active and healthy life like pre-menopause. So education and awareness about menopause is absolutely important. So simple improvements can actually protect from serious health problems. So what are actually the symptoms of menopause? I have divided them into 3 phases. So immediate symptoms, medium-term symptoms, which happen roughly around 5 years after menopause, and the long-term, which happen 10 years and over. So the immediate symptoms, you can see irregular or heavy bleeding issues. So even before menopause, these start off, and then you can have menopause. These are common, but if you do have very heavy bleeding or very irregular bleeding, please do get checked, see a gynecologist, as they may need to do a scan and check out and make sure that the lining of the womb is normal. Like I said, sometimes there can be, in very few women, these can be the early symptoms of any cancer. So it needs to be checked, but it can be normal part of the change. Some women have hot flushes and night sweats, which are vasomotor symptoms. These can start even before the menopause happens and last for up to 2 years after menopause. Some women have emotional and psychological effects like mood swings, depression, and difficulty in concentrating. All these are the effect of the fall in the female hormone called estrogen. Medium-term effects, this is around 5 years. These are usually due to urogenital atrophy. So because of the lack of the hormone estrogen, there is dryness around the vaginal area, around the area where you pass urine. So this can cause difficulty in intercourse. Sexual intercourse can be difficult because of dryness. Recurrent urinary infections can start coming because of dryness around the urinary area. And some women just have burning sensation on passing urine. These are sometimes just part of menopause, and if these symptoms are really bothersome, you can have some local estrogen hormone cream, which can help for a short time, which can help with the dryness, or you can even use a lubricant for intercourse, which can help you. In the long term, so usually 10 years and after, the main goal for women who are menopausal is to prevent osteoporosis or weak bones. So because of the lack of estrogen, the bones tend to become weak and brittle, and there is a high risk of them, breaking with a small impact when you fall, or even just, with small impacts. Heart diseases become equal to the incidence and the risk of heart disease becomes the same as for men after the age of 60. So before that, the hormone estrogen protects our heart. So women have less incidence of heart diseases. And also stroke. Stroke is also a condition where the risk increases after around 10 years of menopause. So how do we combat menopause? Yeah, so eating healthy, eating a balanced diet to avoid weight gain and keep sugar and cholesterol levels in check is extremely important. Exercise reduces hot flashes and improves mood and mental health. For bone health, it's extremely important to be on calcium and vitamin D supplements, and also to do some weight-bearing exercises such as walking, which helps the bones keep strong. So the common areas of fracture are the wrist bone, the spine, and the hip bone. So it's important to strengthen the core, the muscles around these bones, as well as the hip bone, which walking does, to strengthen these bones. Hormone replacement therapy is only now advocated for women who undergo menopause really early, that is before the age of 40, and those who are having real brittle bones and have a high risk of bone fracture. So what is a healthy diet? To eat regularly and drink at least 2.5 to 3 liters of water per day. Reduce your intake of caffeine. Plenty of vegetables and fruits, as well as complex carbohydrates, whole grain, brown bread, brown rice. Adequate intake of protein, which is at least 1 gram per kg of body weight, and to have good fats rather than saturated fats. Important is calcium of at least 1 gram per day and vitamin D about 1000 international units in your diet. So there is something called estrogens in our diet. They're called plant estrogens, which do help in women who have increased hot flushes and night sweats, which is due to the lack of estrogen. So these plant-based products actually have a lot of estrogen, which can help us with these hot flushes. Most important of which is soya and these sunflower, pumpkin, and flax seeds. So again, I spoke to you that importance of osteoporosis, of preventing thin bones, the adequate intake of calcium and vitamin D, as well as regular weight-bearing exercises. HRT, like I mentioned, the only indication for hormone replacement is when women undergo menopause less than 40 years of age, and there are significant menopausal symptoms, and also to prevent the osteoporosis in women who have real brittle bones. So to talk about pelvic floor, what exactly is a pelvic floor? The pelvic floor is like a sling of muscle which protects, gives support to the pelvic organs like bladder, uterus, and the vagina, and the bowel and the rectum. So what exactly these pelvic floor muscles do? They support the organs in your abdomen. They help in the control of passing of urine, gas, and bowel movements. They also contract when you cough, sneeze, or strain, which helps to prevent the involuntary leakage of urine. They need to be fit. You need to keep your pelvic floor muscles fit and adequately toned to carry out their function well. And important is regular pelvic floor muscle exercises, which help by strengthening the muscles so they become firm and supportive. So 1 in 3 women will experience a pelvic floor problem in their lifetime, which includes bladder control problems, bowel control problems, and pelvic organ prolapse, where the uterus and vagina can come down. Having children increases the risk of these problems. Please seek the help of a specialist if you have any symptoms of bladder or bowel control or any other pelvic floor problems. So besides this, like I mentioned, regular cancer screening is also essential for women over the age of 40. So I would suggest an annual health check every year with a gynecologist, as well as when it comes to cancer, the most important cancers to keep in mind are breast and cervix. So these are the commonest cancers in women. So for breast cancer, it's important to do breast self-examination regularly. And over the age of 40, a mammogram is advised. Usually for between the age of 40 to 50, once a year is advised. And after the age of 50, maybe once every 2 or 3 years. Again, the frequency will depend on family history. If you do have a history of breast cancer on your mother's side, like your mother or your sister or your aunt or your grandmother on your mother's side, you do fall at a high risk category. Then please consult a breast surgeon to know your risk and to know how often you should be going for screening for breast cancer. For the cervical cancer, we do a pap smear test.
So just last 1 minute. So if you could.
Yeah, I'm done. I think I have only one slide. So for cancer cervix, a pap smear test is very useful, which is done every 1 to 2 years. And for the cancer of the ovary and uterus, a vaginal ultrasound can help detect that. So maybe when you see the gynecologist, every year ultrasound will also be mandatory. So what are the warning signs? Bleeding after menopause, that is 12 months after periods, bleeding in between periods of following intercourse, abdominal pain that doesn't settle with simple measures, bloating, indigestion for more than 2 weeks, alternating bowel habits, blood in urine or stool, loss of weight, loss of appetite. So I think this is my final take-home message. So menopause, the tips or whatever the main take-home messages are, please adopt a healthy lifestyle and eating and habits and exercise regularly. Keep your medical conditions in good control. Regular health checks and screening is essential to detect cancer in early treatable stages. See a doctor in case of any worrying symptoms. Do not delay. Seek help for pelvic floor problems. They are treatable. Thank you very much for listening.
Thank you so much, Doctor. That was really, really useful. So we'll quickly, we've already opened the floor for questions and we have a few questions. So the first question is for Dr. Vijayashree. So Meena Bansal is asking, women nearing the age of 40 has vaginal pain. So she's asking if it's because of standing for a long time. That's to Dr. Vijayashree.
Yeah, I mean, it depends on when the pain happens. If it happens on standing for a long time, or is that person having, doing something, standing for a long time due to occupational work, or, or does she stand? If the pain happens more on standing for a long time, yes, it needs to be checked. Pain worsening on standing is usually due to some varicose issues. So people can have vulval varicosities in the vaginal vulval area as well. Or it can be usually a dragging sensation in the back. Sometimes is when somebody has a prolapse or the uterus or vagina comes down. That usually they feel as a lump in the vagina, or they can feel difficulty in emptying their bladder or difficulty in emptying their bowels. I think she needs to be examined by a gynecologist to check the area to see if there's any abnormalities in the vaginal area. So just pain, it can be anything.
Okay. So thank you, doctor. The next the question is it normal to lose interest in sex? I think it's because of sleeplessness. I'm assuming this is for Dr. Virginia. I think she spoke about sleeplessness post-pregnancy.
Yeah. So yeah, sleeplessness causes fatigue, and I already explained that there might be vaginal dryness also. So there is no enough secretions, and that also causes a loss in interest in sex, that is called loss of libido. So it usually happens transiently after delivery and it settles on its own. There is nothing to worry. It's not a long term.
Okay. So the next one, is it good to get pregnant at the time of hypothyroidism? So I think this is for, if I'm not wrong, Dr. Madhu.
Hi. Any medical disorder in a person who is trying to actually have fertility treatment or trying to conceive needs to be under control. This holds good not only for hypothyroidism, where the thyroid levels are low, or hyperthyroidism, or diabetes, or hypertension in asthmatic people, or those who have fits. Any of these partners, whether male or female partner, they need to have their diseases or the medical disorders under control before they try and go into pregnancy, more so for the ladies. Because once they enter into pregnancy, this is going to multiply. The amount of problems that they have due to the medical disorders will increase in most of the medical disorders during pregnancy. So it is important that they enter into pregnancy after keeping their medical disorders under control. And that is very, very important that they attend preconceptional counseling. If at all they are planning for fertility, they are planning for pregnancy, then it is very important to attend a preconceptional counseling where a gynecologist would screen you through, make sure that you are fine. You will be given folic acid supplements. You will be made sure that your medical disorders are under control, and if there are any new medical disorders that are cropping up, if there's any problem because of your previous surgical procedures, if at all in the ladies pap smear has been done, and if it is normal, all these are very, very important before entering into a pregnancy. And yes, you can get pregnant provided your hypothyroid is under control.
Similarly, does visceral fat or abdominal fat affect pregnancy? That's also to Dr. Madhu.
Yes, yes. Having a high BMI, which is called body mass index, when the weight of a person is more than what is necessary for a particular height. Both in male and in female, there could be problems with fertility. The increase in BMI or obesity, this is categorized as when the BMI or the height, the weight by height in meter square, weight in kg by height in meter square into 100 will give us the body mass index. When the body mass index of our people are anything up to 24, 19 to 24 is normal. From 25 to 29 of BMI is a bit overweight. When they go beyond 30, it becomes obesity. And when it is more than 40, it becomes morbid obesity. So the chances of having medical disorders become more when the BMI increases. And the chances of having fertility decreases when they gain more. And to know about 5% if they could reduce from what their overweight is, there is a high chance that people with ovulatory disorder start having ovulation on their own. So such importance is to keep the weight in maintenance level or to keep the body weight in ideal level.
Okay.
So it's important for them to lose weight.
Great. So this is to Dr. Virginia. Does thyroid affect breastfeeding? Does thyroid affect the baby during breastfeeding? This is to Dr. Virginia.
So if the thyroid problem is under control, that is post-pregnancy also, if you were taking thyroid tablets during pregnancy, please continue with that. And I've already explained that we have to repeat the blood tests after 6 weeks. So if it is under control, there is no problem. There's no impact on the baby during breastfeeding. And even during the discharge from the hospital, the TSH levels of the baby is checked. So if there is a thyroid problem for you, there is no problem in breastfeeding and doesn't get passed on to the baby and all.
Okay. So what does painful urination imply? She's 42 years old. I think that's to Dr. Vijayashree.
Painful urination can be, the first thing that we always think of in painful urination is a urinary infection. Yeah, that needs to be looked at. So maybe is this something that just happens suddenly? Is there associated fever along with it? Difficulty passing urine, emptying bladder. So these are kind of things that need to be looked at. So first thing, a urinary infection is most common that needs to be checked for. If not, there are other things, like bladder inflammation, where we call painful bladder syndrome. That has to be looked at, but that's a usually less common condition, which we look at after we, rule out urinary infection. In older ladies, sometimes because of sinus, they can have painful urination. So most common is infection and inflammation. So that needs to be looked at.
On the same lines, she's asking what exercises are advisable for pelvic floor muscle strengthening.
Yeah, they are called pelvic floor exercises or Kegel's exercises, which actually ideally have all to be doing these exercises right from pregnancy antenatal period. So I think nowadays catching a little bit with all these antenatal classes going on. So right from pregnancy,
okay, I think we just lost her this one. So okay, so we'll just move on to the next question. So sometimes during menstrual cycle, I get one side headache. Why? So could some other doctor answer this question till we get the network for her solved?
Yeah, one-sided headache during the menstrual cycle.
Yeah, after the menstrual cycle.
After the menstrual cycle. It is related to the periods only. It can be menstrual migraine. It is related to the hormone levels changes. So it comes only during the periods time, just before periods, and it ends after the periods is over. It's called menstrual migraine. Okay. So it settles during that time. There is nothing much treatment necessary around for that.
Sorry, Dr. Vijayashree, we just lost you. So if you can continue. About the pelvic, a couple of them also asked about pelvic floor exercises. So
yeah, pelvic floor exercises need to be done in the postpartum period regularly, and then following that, they need to be continued for life, like at least twice or thrice a week. So to keep up the tone of the pelvic floor muscles. If these exercises are done regularly, we can prevent problems of, difficulty in controlling the urine, difficulty in controlling the bowels. So I will actually put it in the chat box to everyone. There is a website called yourpelvicfloor.org. So this website gives very good information about pelvic floor exercises. There are patient leaflets which can be downloaded and looked at. I will put it in the chat box to everyone so they can all see that.
And I think this question to you again, Dr. Vijayashree, if there is loss of sex interest in menopause, is there some tablets to take, or is there some treatment?
It's quite common. Loss of libido, loss of sexual interest following menopause is quite common. One is because of the fall in the hormone estrogen. Another is it's a lot psychological as well, because of the feeling of going through menopause and a lot of changes happening in the body, changes happening psychologically. So loss of interest in sex is not specifically an indication to take hormones. Although abroad they do indicate certain, first of all, we need to check the hormone levels, the estrogen levels, there are other hormone levels and testosterone levels. And some of them do prescribe certain a small dose of testosterone, which is a male hormone, to increase the libido. But it's not done widely, and not all doctors will do it. But I would say it's a bit more of a psychological assessment thing. I think try to do certain cope with stress, make sure you have adequate sleep, make sure you're doing good exercise or in a good shape, physically and mentally. And a bit of psychological help, maybe a psychologist counseling, will help you go through it. It's very, very rare. I wouldn't advocate hormones for loss of sex post-menopause. Maybe there is a bit of dryness which is causing difficulty in intercourse. That can be addressed with using some lubricant. So I would advocate more of the healthy lifestyle and a little bit of psychological counseling rather than taking hormones post-menopause for loss of sexual interest.
Okay. The next is to Dr. Virginia. There is nipple itching with pus. How can it be treated?
So nipple itching can be because of the dryness in that area. If there is pus, then it means it's an infection of the ducts in the nipple. There is the ductal opening is there in the nipple region through which the milk flows out. So if there is mild infection, or we call it as a widening of the ducts there, or ectasia, which has been infected, that is why that pus comes, a greenish color pus comes. So antibiotics has to be prescribed. So you need to consult a doctor.
Okay. Next two questions are related to intercourse. There is heavy bleeding, there is bleeding after intercourse post 40 years. That's one. And there's burning pains. So can probably Dr. Vijayashree answer both these questions?
Sorry, you said bleeding following intercourse, is it?
Yeah, after 40.
After 40.
Yes.
So bleeding following intercourse at any age is not, needs to be checked. Yeah. So in the younger age groups, bleeding following intercourse, we think of infection, or even, sometimes it is a starting symptom for any cancers of the cervix. So make sure that this person has had a pap smear test recently, and that's normal. Make sure they've checked out for any pelvic infections and had some treatment. Sometimes it is an infection which causing bleeding following intercourse, or sometimes there is a lot of dryness. And that's the reason, or there's not enough lubrication, and that's causing. So bleeding following intercourse always has to be checked. Please see a gynecologist and make sure there is no sinister causes. Once those are ruled out, then it can be managed as whatever is needed.
Okay.
What else do you say?
Then there's burning pains. That is not above 40. That's a general question. Burning pains after intercourse. Is it really?
Yeah. Again, burning pain, usually in older women, it's usually dryness and vaginal dryness needing lubrication. In younger women as well, some of them who have burning pain, it just means that the penetration is too early. I mean, they've not had enough lubrication. There is not enough foreplay. So if you're not wet enough, the lubrication is not enough, you're going to have burning sensation. So that needs a little bit of, psychosexual counseling.
Okay.
And of course, locally, you need to check for any vaginal infection or vaginal lesions. So yeah, you need to see a gynecologist.
Okay, thank you.
And sorry to add on, in case this happens in a male partner, it is also important to screen the male partner for any prepucial infection, any infection in the genitalia, check his sugar levels, make sure that the sugar levels are under control.
Okay, thank you so much. The next question is about breast sagging, and that's to Dr. Virginia. So how do we stop breast sagging after breastfeeding? What do we do?
You can't do much about it. Actually, if the breasts are full and it's actually the stretching of the breast and the size increases to twice or thrice full during the pregnancy time even. So adequate support at the correct size bra has to be worn. So proper fitting bra has to be worn from during the pregnancy time and even during feeding time, because the feeding bra has to be used. So if it is not used, then the sagging is more. So proper breast support can reduce the sagging, as well as proper moisturizing the breast by oils also helps. And post-delivery, there are a lot of exercises for the arms as well as for the chest muscles also. All this will help the breast to come back to its shape, and as well as getting back to shape as early as possible post-delivery. All this will reduce the size of the breast and prevents sagging, but you can't prevent it completely. So some amount of sagging is going to be there. It is not going to be the same as it was before pregnancy. So if it is very severe, only then people go for breast augmentation surgeries. But usually a proper breast support, moisturizing the breast adequately, and doing exercises and losing weight, all this will help this problem.
Okay, thank you. So I'll finish with this last question. How effective is the cervical cancer vaccine, and what is the right age to take the vaccine? And that's to Dr. Vijayashree.
Yeah, cervical cancer vaccine is quite effective nowadays, and it is quite good in preventing cancer. So the right age to take the vaccine is actually before the onset of intercourse, before you become sexually active. So ideally, it needs to be given in young girls around 12 to 13 years of age, before the onset of sexual activity. So this is a vaccine. It actually prevents the virus called HPV virus from getting into the cervix, and this is the virus that causes cancer, cervical cancer later in life. And this virus comes through sexual intercourse. So the ideal age, so if you have girls, so around the age of 12, 13, talk to your pediatrician and get them vaccinated for cervical cancer. And that's the best age for them to have it.
Okay, so thank you so much, doctors. Unfortunately, there are tons of questions, I'm sure, but due to the paucity of time, we need to quickly stop here. I would like to give a brief summary of what we discussed today. So thank you so much for an informative session. So we had Dr. Madhu talk about the reasons for infertility. Importantly, male and female infertility ratios are almost the same. The factors and the reasons, and most importantly, when to approach a fertility specialist. So that's, I think, going to be eye-opening for a lot of us. Next, Dr. Virginia, I think most relevant to me with a 9-month-old infant, the post-pregnancy care, how important it is to to have a physical and emotional well-being, combat postnatal blues, and what needs to be done to have a very, very safe and a happy delivery, and also a post-pregnancy period. Then we had Dr. Vijayashree. Not much spoken about topic, I'm sure, was kind of eye-opener for a lot of us who's approaching that age, and how serious it could get if we ignore our health post-menopause. So I think thank you so much to all the 3 panelists for spending their time with us this Sunday morning, and for a lovely audience who were very, very patient enough with us. Now, this is, as most of the audience here know, this is not a one-time talk show. We do have a lot of interesting topics that we keep organizing as a part of the makkalnalan initiative. The next 3 talks are going to be one on personal branding. So now branding is what everything is about. So it's important for us to know what works for us. The next is going to be a talk with a neurologist, orthopedics, and about blood donation. And the third is going to be probably the most relevant for today's scenario, where we revive ourselves and relax ourselves. So this is going to be extremely important for today's in Corona age. So I'd like to thank all the participants and the panelists and the organizers for organizing such an eye-opening talk about women health and well-being. So thank you so much. The audiences can log out. So thank you. The panelists are requested